because he's been NPO after surgery, but the bowel just keeps coming up. So they facilitated an order for NG2. When we decompress the bowel, if you have gastric enzymes constantly going down your small and large intestine, can your bowel rest? No. That's why we decompress it. If we allow the bowel to rest, could maybe those intestines potentially untwist on its own. All right. So that's why we have an order. The first thing you always do is check your order. All right. C in the NCLEX Perfect World, they will tell you your size. A lot of times they don't. Typically, like I said, majority of the time you're putting a 14 or 16 down an adult patient. I've never worked with peds or neonates, but like I said, 8 French, that's the smallest you would think it would go for a neonate.
A full-term baby is 10.
10?
Yeah, but pretermers then get smaller.
Okay. So we have all our equipment, and what we want to do is go ahead and kind of just let him know about what's about to happen. All right, Mr. Checkits. Of course, knock knock. Hey, Mr. Checkits. Hand hygiene. How you doing today? My name's Miss Mobley. I'm going to be your nurse. Well, the doctor ordered your NG2 because I know you've been going on so much after surgery. This is not a pleasant procedure. I do want to tell you that. Hopefully we can do it quickly. You drink the water when I tell you to drink the water. It will help facilitate the tube to go down smoothly. It is unpleasant, but once you get the tube down, you will feel much better in terms of not having to vomit a lot. Okay? I'm just going to drape this towel over you. Of course, would you put on gloves?
Yeah.
I don't have any right here, but are you at the potential of exposing yourself to bodily fluids? Yeah. Did you put on gloves? All right, Mr. Checkits, I'm going to just place this pretend towel on your chest. We have to make sure you're sitting up real high. I'm going to go ahead. The doctor has ordered, once I get this tube down, we are actually going to hook you up to suction. And this is your suction device. What it pretty much does is, once I hook this up, this will continuously suck all that stuff out of your stomach for you. Okay? So, we have our suction all ready. Your suction in your NCLEX Perfect World, your doctor will give you your order. It can be intermittent, which means it goes and then stop, intermittent, or it can be continuous, all right? Typically, when on your dial, there's one in the LPN office lab if you want to see it, but it has low, medium, and high. Typically, we're on the higher end, 120 to 160 millimeters of pressure is what's sucking this out, okay? So we got our suction all ready. We have my gloves on.
Yeah, magically appeared.
All prepared. We want to go ahead. We have our basin. Y'all need to understand with your basins, you always date time. Because will we use this? For instance, if we have to push meds through this, do we have to flush? Do we have to verify gastric content on the thing? So you will use this. It's only good for 24 hours. So initially open, date and time. You make sure you have some nice ice cold water. You can already have the tape pulled out and prepped. When you do tape, sometimes there's tape that is already specifically cut to wrap around the tube. If you don't, you literally, I can't do it with my gloves on, take the tape out and cut a slit and just wrap that slit around the tube, okay? I have my pH strip all ready. And you see how the colors are coordinated with the value? And for your book purposes, what do you want your pH to be less than?
5.5.
Do you see in the video they said 4? It just depends on what you're being tested at. You want everything very close to this patient. When I tell you that bowel can come quickly, you always have a second. So we needed, when we used to do air auscultation, you'd always have a second nurse there. For general practice purposes, it just helps to have a second nurse for hands, okay? So, Ms. Herndon will be my second hand. And what I like to do, the person inserting it, if the patient, for instance, a lot of times it's hard for them to hold the water and drink it themselves. Usually the second nurse is the one that's holding it and telling them to chug, 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 chug. So, we have our NG2. I told you it was a 14 French. And the first thing I'm going to ask is, Mr. Checkit, so have you ever had any nasal surgery, trauma? Has your nose been broken? What side of your nostril is better for you in terms of being more open? Your right side? Okay. So we are going to go down your right nose, all right? If you, when you're putting it down, a lot of things you need to know. When you're inserting it, you never shove it. ever. If you meet resistance, you stop. Sometimes when you're pushing it and it just doesn't seem right, you can look in their mouth and see it coiling. If you go into their lungs, a lot of times you know very quickly because they start coughing, all right? They're gonna be gagging anyway, but just little things. So you open, this is not a sterile process whatsoever. You just look at your equipment, all right? So do you see how I told you a lot of them have the numbers on there, which we like, all right? And then you have this. You always keep this. New nurses throw this out. This is what allows you to attach that to this. If you lose that piece, it's very hard to attach. There should always also be an extra piece that covers this, all right? Because fluid and content can get out of this side too, all right? But this is just another way you can inject air or push whatever you need to push, okay? So always keep your little pieces. So Mr. Checketts told me that his right nostril is the most patent, so that's what we're gonna go down to. First thing you do is measure. Does anybody remember how to measure?
Yeah.
Earlobe to the xiphoid process.
Tip the nose, tip the earlobe, and then we go down, xiphoid process, all right? So he is measuring right at 46, all right? You can either take a piece of tape and wrap it around. These are measured for you, or you can remember 46, okay? If you saw the tube on the video, there was no numerical value, so they had to put a piece of tape, or sometimes if you don't have a numerical value, you can put a marker on it. You can take a Sharpie and just mark it. So we want to get down to 46. Just to let you know, on these mannequins, you will not get 46 centimeters in them. It's not gonna happen, okay? They don't go that low. All right, Mr. Checketts, I've measured you, okay? The first thing that you're gonna feel is just me going into the tip of your nose, okay? Once I get to the back of your nose, I want you to put your chin to your chest, and Ms. Herndon is gonna have this ice cold water for you, and we're gonna tell you to chug, 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 chug. When you drink, it will help facilitate the tube going all the way down. The last piece of equipment that we need to find, y'all, is lube. You wouldn't really lube these tubes because we don't want lube going into the mannequins. You saw how they take the lube and they put it at the tip? I take the lube and I put it down the whole thing, all right? Just facilitates it going better. But of course, you just can stick it in your lube, all right? So we've measured, we've lubed, he's sitting up. So lube it, and I'm gonna say, do you see how I have it sitting in my basin? All right? You can have your suction hook up, but sometimes it starts coming out very quickly. All right, Mr. Checketts. Typically, their natural alignment when you first insert it. It's when you get to the back, when they almost start gagging, tell them chin to chest, and then drink, 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 drink. So just start and just test it, all right? Just put it in their nostril. Don't just start shoving it in, all right? Put it in their nostril and say, hey, how you doing, Mr. Checketts? All right, now it's gonna start getting a little uncomfortable. You hit the back, chin to chest, chug, 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 smooth motion. Chug, 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 chug. And I think it stops. I'm meeting resistance. Would I ever shove?
No.
No, but let me see how far this guy will go down. That's it. So we got to 23 centimeters. Are we anywhere close? No, it's just because it's a mannequin. We remember we want to get down to what?
46.
We're at 46. So that whole tube you should facilitate going all the way in. Once we get it here, we would go ahead. I would ask Ms. Herndon to hold it. And what I would do before I like to take, just because you want to check, I would go ahead, say no gastric content came out. If your gastric content came out, can't you literally in your basin take your strip, nothing sterile, and dip it in there? Yeah. Visualization of gastric content is that one check. Yeah, nothing came out. So what am I gonna do? Let's aspirate. Pull it back. You take just a little, put it on your strip. What do we do with the rest?
Put it back in.
Push it back in. All right. And it's saying, oh, it's 4. Are we good to go? Yes. What is your last check? Let's pretend it's NCLEX purple. I have this bedside chest x-ray right here. This is perfect world. They chest x-ray it, it's right in the stomach, all right? So now we are going to tape everything up. And you see how, Ms. Herndon, we can just cut a little slip. And of course, if these gloves, I would change my gloves. You always remember, gloves, you can literally just cut this slip up your tape. Pink tape actually holds very well. Another thing that you usually want to grab, has anybody heard of skin prep? Okay, skin prep, it just makes it sticky. That's what you saw her rub the nose with. We rub the nose with skin prep. And you make sure somebody has their hand on this tube at all times, all right, before you tape it up. And you literally, if you cut a little slit, we verified it with our 3 checks. And nice and secure. I've hooked my tube up to suction. You'll see it all start to flow. And you don't just leave it dangling like this. You saw how they had a rubber band, okay? You typically don't have a rubber band, but what you can do is take another piece of tape. And sometimes they have securing devices. You can literally wrap the piece of tape around the tube. Put the safety pin through the tape. And then pin that to their gown, okay? You always wanna make sure they're slack, okay? If I was pinning it all the way down here, do you see how it's pulling on it? Always make sure they're slack, alright? Pin it to our gown. Perform oral hygiene, and you're good to go.
Shouldn't you ask